that I ever actually consciously made the decision. I think from a very early age, I always thought I would become a nurse. I went away for it for a few years in sort of high school, but then I was really interested at the end of high school to do something that I could take with me, move around. I was always looking for adventure, and I knew I'd be able to travel with it. And so that's what got me into it. I never thought I'd stay more than 5 years, and here I am, 40 years later, a nurse and still loving it. I can still remember stories. I can talk to you about individual patients that I remember the relationship I had with them throughout the years. But I think more importantly for me was the diversity and the ability to continue to learn, to move on to new roles. But there was always that opportunity for more learning and something new to do. It has so much opportunity. The teams and people that I've worked with have been just so wonderful. It's like a new adventure all the time. And so I think for me, it's the commitment I see around me to this hospital and to this community. And I just feel so lucky to have been a part of it all of these years.
I've always been passionate about nursing. I've always enjoyed caring for people. I find it rewarding to watch people progress into wellness. And if I'm there for the end of life stage, I find it a privilege to actually be able to assist them in that transition. Every day is a new day, and every day is a new opportunity to learn. So you're never really stagnant in your career. I work with a wonderful group of people. I feel that my voice is heard. You know, my concerns are respected, and it carries weight with the decisions being made here at Grand River Hospital with not only how the organization is run, but how we are able to provide exceptional care for our patients. And because of that, I feel that, you know, we're respected as nurses here. And it gives you a sense of well-being as well.
When I first worked as a hemodialysis technician, I actually got to observe the dynamics between the patients and the nurses, and it really opened up my eyes to see what nursing was about, and I never had that experience before. But then when I was in nursing, I noticed that there were some gaps in patient care, and I felt that the only way that I could really make a difference and partake and participate in improving these gaps was to go back to school, because I had to enhance my knowledge. And I went back and did my master's, and then from there I transitioned into the role of an APN. Definitely it's that sense of reward that you get from patients and their families. So a simple thank you that I get from patients when I've worked with them. For example, I work with a lot of geriatric population here in the renal program. So even when I go and do home visits, and then you hear from that family member, the son, the daughter, or even the patient, like, thank you so much for helping to provide resources, and you know, we don't know who else to turn to or who to go to. So I think for me that does bring motivation. A large achievement for me was being able to complete a best practice guideline fellowship, and I had a lot of support from you know, managers, directors, from from senior leadership to go ahead and complete this. So for me, that was a huge undertaking that I felt support from them. So Grand River Hospital, I really do find that they want to see you grow, and they want to see you improve, and they want to see you do well from your own professional learning needs.
The two words that I think of with our nurses are compassion and collegiality, and I've really appreciated that as a colleague. I've appreciated it on behalf of our volunteers. We have 35 who come in at different times of the day and night, and then we have another group of 300 local faith leaders, and they often mention how, another way to say it is how hospitable the nurses are to those colleagues. I think of some very special occasions, even at very sad times, when nurses have organized, for instance, a wedding for a patient or a family member that had to be in the hospital, and the extra length they went to do that. I think of the boutique that's been set up in Emerge. We have families who arrive from terrible circumstances, patients that may not have any clothing really on their back, and they've set up a boutique to help them have something to go back out into the world. I would say without hesitation, we talk a lot about length of stay in the hospital. What I think of with our nurses is length of service. And having worked in several different settings, I'm struck by how many very experienced nurses we're lucky to have on the staff. But what extends from that is their mentorship of the newer nurses. And I think they set a very good example for all of us in all of our professions to mentor new colleagues.
I was first interested in being a nurse when I was 14. I started volunteering in a nursing home and developed a strong feeling that I wanted to be a nurse at that time. Definitely, I've seen really good things come from the programs that I've worked in, especially in specialized mental health, enhancing the quality of our patients' lives and seeing the good results that we do as a team here at Grand River Hospital. Definitely, I would say the openness and willingness that the hospital has provided as far as education, providing more opportunities for RPNs to move around between the two sites. Definitely where I'm at right now, I have to give a lot of credit to the management. We have an excellent team, and it's really been a drive for me to stay. I have no desire to go anywhere else. I'm very proud to work for Grand River Hospital.